Welcome to We're Engaged, the podcast that features Purdue University's College of Veterinary Medicine's community partnerships. I'm your host, Sandy San Miguel. I'm the Associate Dean for Engagement here at Purdue Veterinary Medicine. I'm really excited to share with you all of our wonderful partnerships that we have. And the goal here is to inspire you to either join up with one of our partnerships, support a partnership, or start your own community partnership. Today, we're highlighting our partnership with the Humane Society of Clinton County. Thank you so much for being on the show.
Hey, thank you for having me.
Let's start by having everyone introduce themselves, which organization you're from, and your role.
You want me to start, Emily?
Yeah, go for it.
Okay, my name is Cheyenne Taylor. I am the director at the Humane Society of Clinton County in Frankfort, Indiana, and I will be celebrating my 6 years here next.
Excellent.
I'm Emily Curry. I am a clinical assistant professor of shelter medicine and surgery here at Purdue College of Veterinary Medicine. And in my role, I teach students mostly in the clinical setting, and we care for shelter animals, some of which come from Cheyenne. And I just celebrated my 5th year in my role in February.
Excellent. Well, again, thank you so much for being on the show. Let's start off by having you tell us about your program.
Okay.
Cheyenne, can you tell us a little bit about the Humane Society?
Yeah, so we are located in Clinton County, Indiana. So it's about 25-30 miles south of Purdue. So it's great that we get to work with them because we're not too far away. And we're a 501c3 organization. Most of the time, we run off donations and things like that for funding. We do get funded by the county a certain amount. Typically, most of that does go to animal control. So we kind of go off our donations, our adoptions, and work with cats and dogs here. We don't pocket pets like rabbits or ferrets or like that. We do dogs and cats here and adopt them out, and we take from Clinton County only. If someone contacts us from outside of Clinton County, I have to get approval from the county. A cat from out of county. A lot of people don't know that when they call us and ask us for help. But yeah, so we deal with dogs and cats from Clinton County. But most of our adopters come from out of county. So I work with people all over the.
Can you tell our listeners how you're working together? What does the collaboration look like? And, what's your mission and why is it so important?
Yeah, so I can take that one. Our mission with Priority for Paws, our shelter medicine program at Purdue. So the P4P program actually started back in 2012. That's when it was on a mobile surgery unit. And that was started mostly by PetSmart Charities grant. And the mobile unit would travel to shelters and rescues all over the state of Indiana, providing care and spay and neuter services, mostly at that point. And so when I took on this role in 2019, we were still utilizing the mobile unit, but it was starting to phase out a little bit. It was starting to show wear and tear. A lot of the shelters and rescues had transportation vehicles, so they could come to us. And then when COVID hit, we stopped using the mobile unit at all anymore, but we wanted to keep our mission and our program going. So now our shelter and rescue partners largely bring patients to us, and we have an expanded surgery and primary care medical space at the veterinary hospital. So it's really nice to be on site. We can also, utilize resources of specialists down the hall. If a patient has a special need, we can collaborate in that way within our own hospital. But I first met Cheyenne in 2019 when I started, and we were going to Humane Society of Clinton County on the mobile unit. And she was not in her current role at that point, but she was with the shelter. And that's where we started our partnership. And we've continued it and strengthened it, even though it's changed and evolved and grown over the years. We've always been able to pivot. And like Cheyenne said, because we're close enough, we're lucky to still visit Humane Society of Clinton County here and there for medical days. Actually, we have one coming up on our next block. So we'll bring some supplies. And Cheyenne will have a list of different animals she'd like us to check out while we're there. We'll examine, we'll consult, we'll vaccinate, we'll do, basic diagnostics, provide treatment recommendations, things like that. So it's a really great opportunity for our students to, again, get that hands-on learning and also be part of their communities around them so they can take that with them. So, yeah, it's been wonderful.
It's awesome.
I love this. I love this. So, what's been the impact so far, Cheyenne?
Oh, it's been a huge impact. Like she said, when COVID happened, we got a little nervous that things were gonna shut down or something, because even though COVID was happening, animals were still reproducing, were still, son. I think that now more than ever, the effect that COVID had on the vet really now starting. For instance, I called one of our vets yesterday, tried to get cat to be. They weren't even able to till 6 or 7. So it's kind of like it happened right after COVID. I feel like that's we're very right away. But even it's difficult to even honestly get anything scheduled at the vet right now. So we're super blessed to have Purdue. Also, it's kind of the only way that we even make money on adoptions. For instance, we, get the care from Purdue for free unless there's some extra testings that we need to do or they find under anesthesia. The general spays, neuters, vaccines, preventions, we get all of that done for free. So that's kind of how we get ahead on some adoptions, because if we're having to get our animals scheduled at the vet like a regular pet owner, then we're losing money altogether when it comes to adoptions, because it's well over $100 for us to pay for each pet. Dogs, it goes by weight, so some of them are even close to 200, which is what our adoption fee is to begin with, let alone the boarding here, paying for people to take care of them, the food, the prevention, the vaccines. So it's really kind of our only way that we ever even make money on adoptions is if those animals were done by Purdue. So it makes a massive difference for us here at our humane society, that's for sure. And I'm assuming everywhere else as well.
And that's always been a huge goal of ours, is to keep it free so that we can ease up some of those other limited resources already for our shelters and rescues and be able to take this off their plate. So our program relies heavily on donations, endowments, grants, to be able to provide that care. But that's something I'm very passionate about, and I really want to fight to keep it that way. It's always been that way since the start of the program. And now that we've expanded the care that we can offer, I think it's even more important to keep it free to these shelters and rescues. Like Cheyenne said, if something is found on exam or under anesthesia or postoperatively that's out of the ordinary, we need to address. At that point, we talk to the shelters about, this is what this would cost, because we can pursue things at Purdue, but it would cost more money. Are you able to pay for this? Or we'll try to work out some type of agreement. But that keeping the cost of other things free allows those shelters and rescues to then say, yes, we do want to pay for x-rays for that patient or for a biopsy or something of that nature that's really needed. So that's really wonderful too, because it expands the care we can provide and the training for our students.
That's wonderful. Wait. So tell us about the students. What experiences are our students getting?
Yes. So we've been trying over the past year and a half to capture more of the medical experience that the students get on this rotation, because it's largely, for a long time, been thought of as strictly spay-neuter experience, which it is a lot of that. But since we've moved to our space in the hospital, we're able to expand our care a lot. So it's a lot more, basic primary care diagnostics, ear cytologies, checking eyes for infection or ulceration, skin scraping, fine needle aspirate, all those kinds of things, vaccinating, preventions. But it's hard to capture that data as much. So it's a lot easier to share our surgical data, but just know that all of these patients that the students are doing surgery on, they're also doing, thorough physical exams on and providing recommendations and, treatment options and things like that. So in the past year, the class of 2024, we served approximately, it was 62 students over the course of May to May. We had about 50 vet nursing students with us as well, which is really exciting for us. We did 1,767 surgeries on site at Purdue, and then the students performed an additional 465 surgeries off site. So places like our Indianapolis partnerships where there are shelter vets and surgery suites. And our students over a 3-week rotation averaged, let's see, just about 30, well, the numbers work out to 36.5, but they were doing whole surgery. So we'll say 37, 37 surgeries in 3 weeks. And that's for each student. And on each rotation, we have typically 5 doctor of veterinary medicine students with us. So each 3 weeks, that's 37 times 5 surgeries we do in our program. And each student gets about that 37 surgeries, which is huge for them. Before they come into our rotation, many of them have done a handful of surgeries, maybe a spay and a neuter, or maybe just spays or just neuters. But this experience really just catapults their confidence and their competence and really helps them carry that over to the rest of their 4th year, knowing this was something really hard and scary, and I did it. And now I can do it. And it's really, really cool to see. So, and that number has steadily grown over the 5 years that I've been here. We've increased that number more and more.
It's absolutely phenomenal. I was one of those students when I came through. I had less than a handful of spays and neuters when I graduated. So this is just an amazing program for our students and for the community, for all those animals that will get adopted into loving homes.
And that's one of our favorite part about the partnerships is when the animal comes to Purdue for their spay or neuter and they never actually even go back to the shelter because they get adopted from a student, from faculty, from staff. We pride ourselves on being professional adoption liaisons and enablers on P4P. And we have a whole photo board outside of our surgery area of in-house adoptions, as we call them, of happy stories. And they're not all from Humane Society of Clinton County, but a lot of them are.
Yeah.
And that's the coolest thing, especially when the student did the care and the surgery and then they take them home.
Yeah.
It's just such a cool full circle.
Just heartwarming.
Yeah, I love when Emily texted me and she was like, "Is Tompkins available? Because somebody wants him." I'm like, please.
Yes. And he's doing wonderfully, by the way. His name is Ping now.
Oh, I love it.
That's fantastic. Well, excellent. Thank you for sharing about the partnership. Another piece of this podcast is to talk about logistics because we want our listeners to hear all the different strategies so we can expand our number of partnerships across the world, not just at Purdue. So I have some just logistic questions, but first, you touched a little bit on it, Dr. Curry. How did you meet? How'd you connect?
Yeah, I mean, I was fortunate when I came into my position, the Priority for Paws program was already up and running and started. I participated as a student in veterinary school and then was fortunate enough to come back and be able to teach. So that part was already set up and there were many partnerships already established, Humane Society of Clinton County being one of them. However, just through the shifts and changes with personnel changes, with COVID, with the changes in our program, we've really had to work to make sure we keep that partnership going. I think it's taken a huge commitment to really good communication on both of our ends. We're both very committed to this partnership and we want to grow it and build it and see it through. And I think it's just building that relationship and trust over time. Cheyenne knows she can reach out to me if there's an animal question. I know I can reach out to her if I have a question about animal placement or what they do in their organization, just things like that. And then fun things, we've also gotten to become friends over time too. We were both working moms and we share in a lot of those joys and struggles, and try to support the shelter as best I can, even outside of my role. So one year I got to go to the golf outing that they have every year, and hopefully I'll get to do that again. But just things like that, it's truly building just a solid relationship working, and sometimes that gets to spill over into personal, but that commitment to keeping it going.
So tell me more about the communication. How often do you communicate? How do you communicate?
Well, I bug her at least every couple of weeks about an animal question, even just things that are in foster care. And I'd rather pick her brain than, try and, wait a while for one of our vets in the area to call me back just to see what her advice is. But I mean, I don't know. I feel like we just talked last week.
Yeah. It ebbs and flows, I think, but sometimes it's, every day. Sometimes it's every couple of weeks. In my position right now, I have a colleague, Dr. Hill, who's in surgery students today, so he couldn't join us, but we rotate. So every 3 weeks, one of us is on rotation. And in our program, because we don't have, scheduling liaisons or administrative assistant help in our program, we do all of our own scheduling. So we're communicating with our partners a lot, which is nice because we can create our own schedule. We have a lot of autonomy, but it is a lot of work. But I honestly think that's helped grow our relationships and our partnerships because we're the ones doing the communication. So it's not just, hey, I've never met you or heard of you, but, we work with you all the time. We don't get to see them in person as much, but we're constantly communicating through email, we use GroupMe a lot, the messaging app. And that's nice because you can have multiple people, but you're not actually sharing your cell phone number necessarily. For those that, if it's a professional relationship, that's been a big thing for me to learn is you don't give everyone your cell phone number. It's those that you really trust and know won't overutilize it, will utilize it well. But Cheyenne and I, we do communicate through cell phone. Like I said, we've become friends over time, but a lot of email, a lot of GroupMe communication, sometimes phone calls, but not even that much. Honestly, a lot of what we get done, can be done while we're busy doing a million other things, but we can have an email going or a GroupMe message. So I'd say that's the majority of how we communicate.
Yeah, I was gonna say before GroupMe, did we just text each other or?
Yeah, and it was like constantly utilizing different platforms to try and get everybody involved.
Yeah.
Because, I would communicate with the shelter or the rescue, but then I'd have to communicate that with my technicians and then communicate that with my students. So GroupMe's helped streamline it a lot. So we're all on the same page. There's still a million different ways to communicate, but it has helped bring those. We have different groups for different individuals that are involved in different conversations. So each shelter has a group with the technicians, Dr. Hill and myself. No students are on that. So we can talk about cases or animals even after students have moved on to another rotation. And then we have a GroupMe that's just our P4P team. So Dr. Hill, myself, and our techs, we can talk about internal stuff. And then each block, we have a GroupMe for the students on that rotation and the techs on that rotation. But the shelters aren't part of that. So it's different groups, but it does help keep it all compartmentalized so everybody gets the information they need.
Excellent. So you've had a really long relationship, and you talked about how you've grown, both parties have grown.
Yeah.
How do you sustain the relationship, and what's next for you? What's your next goal?
Oh man, I don't know. I feel like we utilize you guys as much as we can.
Yeah.
I do want to say it is not, you would think that it is, but it is not my goal for them to have the travel spay neuter vehicle come here. I really like taking them there because like she says, we can utilize other take advantage of, the ophthalmologist came down and looked at a dog's eye one time because they were just available. The x-ray machines are there if they have time to do extra stuff. So you would think that maybe I would say coming back here, but I love our in-house work days that aren't surgery days. But when it comes to surgery stuff, I love the way it is now, big time. Even though I did like when you came here because we had the board of directors like make homemade meals for
Yes.
lunch. We
It
would all
was
eat
delicious.
together. That was fun. But
Yeah.
I do it's so much more beneficial for us to just transport them there, have all that extra stuff on hand. So I mean, I'm really happy with the way things are. And we at least I feel like take trips over there 2, sometimes 3 days a month, even if it's a little bit of a shorter group of surgery patients that go. It's worth it to us, and I know you guys do a lot of other places as well. So, but
Yeah.
I'm happy with where things are at, and I love our super adoption event that we do every year.
Yes, I forgot
So
about
I'm
that.
hoping we get to do that again this year. But yeah, I'm happy with the way things are. I honestly don't have any goals other than to just keep it going.
Yeah, and I would say my goals are as well to maintain, honestly, because the communication is so reliable and good with Cheyenne, as compared to some of our other partners, can be a little bit trickier with personnel changes or things like that. I utilize her a lot on each rotation, and she's always able to support what we need, and I feel like we're supporting her. So it's a big partnership that I rely on during our rotations for sure. I would love to build more of our presence potentially there at the shelter in terms of, encouraging student volunteers to go there since it is pretty close. Whether that's vet nursing students, DVM students, pre-vet students, just to not only increase their animal experience and their experience out in the community and caring for animals day in and day out, but also to help the shelter at the same time. Students are always coming to me asking how they can gain more experience. And that would be a place where it wouldn't necessarily be surgical experience, but they need all that other experience as well. Animal handling, reading animal behavior, understanding what goes into an organization like this, feeding, walking, cleaning. I mean, all of those things are important animal care experiences that shape your career later on. So that'd be my biggest goal, is so that we can have a presence there even when they don't have a P4P day or we don't have a medical day there. I'd like to be able to offer that for our partners.
Yeah, that's a good point because I'm doing intakes daily. So, I have new staff switching out, have to train them how to do holding, things like that. So I could use some holders, or I can hold and they can get some, more experience in blood draws and giving vaccines, things like that. So that's a good point.
Absolutely. Yeah, I think that would be excellent. See, we're building new opportunities right here.
I know, I'm loving this. This is fantastic. Hey, are you ready for the lightning round?
Oh boy.
Oh,
you haven't seen these questions, I don't think.
Nope. Are you going to say who it is, or are we like trying to buzzer before each other?
You can shout them out however you want to do it.
Okay. Look, we got this.
Ready.
What is one word to describe your partnership?
Collaboration.
Reliable.
Oh, what did you say, Cheyenne?
What did you say?
I said collaboration.
Oh, I said reliable.
Yeah.
I don't know. So many words, not the first thing. They're very reliable. We're reliable with each other. I
agree.
Excellent. Okay, what has been the best part of the partnership so far?
Aww. But the first thing that came to my mind was friendship. I love Dr. Hill too. I know he's not here, but he's awesome. I love him too. Just probably all the animals that we've helped. I feel like she can agree with me. All the animals that we've helped to get into homes and get them ready for homes.
Yeah, getting to see the success stories is huge. So especially there have been a couple that Cheyenne's let me know about, like when they've come on intake and they were in really rough shape or had a really tough story. And then, she cared for them a while before they even came for their spay or neuter, but I felt like I already knew the animal.
Yeah.
And I could share with the students, like, look at these before pictures and look at where they are now. And then she's, she keeps me updated, or I follow them on social media about their story from there, or a student adopts them or something like that. And that's so cool to see, just to know we had a part in that story. I think one of my favorite stories though of our partnership is that it was just last year or earlier this year? I think it's earlier this year. we went on a medical day to visit Clinton County, and Cheyenne said, "Oh, look in that kennel there, that's Dr. Curry and Dr. Hill." And there were two little kittens they had named after us, and they nailed the personalities. Dr. Hill was sitting in the kennel, calm and cool as can be, and Dr. Curry is just like running circles around him. And he was so like, true. Okay. And it was totally our personalities. It was so great. And then they came through P4P, got spayed or neutered, and got adopted. And so just really fun stuff like that. I think that's the best part about it. It's just we're always working towards a common goal. And to see how that plays out with the strength of a partnership is so cool. Like, we can't do what we do without them, and same, like they can't do everything they do without us. So it's just really neat.
The definition of engagement.
Yeah.
So what do you think surprised you about working together?
That's a good question.
I don't think so.
I guess I didn't know I would get such a friendship out of it. I mean, I knew professionally we worked well together and everything, but getting to bond, like I said, as working moms and those in the vet field, it's we're a unique subset and in the animal welfare community. So that's really just important to build your village in that way, your personal engagement. And so I guess I wasn't expecting that, but I'm just so glad that happened as a little benefit, icing on the cake.
Yeah.
That's wonderful. And it's a perfect segue. So what advice do you have for others who want to build community partnerships?
That's a good question.
I'd say just don't sell yourself short. You never know what you might be able to offer someone else. And also just be brave in reaching out. If you feel like there might be an opportunity, go for it. There have been lots of situations in my role where we've had partnerships or tried to start partnerships and they didn't really pan out, but there've been so many that they have, and it may have just been off of an email someone sent us reaching out for help, or meeting someone at a conference, or a speaking engagement or something like that, or even like an event to raise money for a shelter. I go to those all the time and meet people. So I guess just don't underestimate where you might find connections and partnerships.
True.
And I think also a bit of kind of trust your gut. If you meet someone and you feel like, wow, I really jive with them, and I know that we are on the same, we have the same goals in mind, and I think we could really work together. I think that's proven over time. That means a lot. That to see what you can work out. And keep an open mind. It may not work out in the way that you envisioned, but sometimes it goes in a different direction that's even better. Or expands. So, yeah.
That's good advice. Cheyenne, how about working with the university? What advice do you have?
Just remember, it's not just, I would say, I don't know how other shelters work with you guys, but just remember, it's not just one-sided. It shouldn't just be Purdue University and their staff reaching out. You have to stay in communication with them as well. They're really good about it with me. It's only been a couple times where my list of cats and kittens gets really long to get fixed. I'm like, are you guys scheduling for September yet, or something like that? Like, I'm a little ahead of myself. But you just have to remember it. You got to stay in communication as well. Let them know that, you're on it. You're thinking about who's next on the list. And trust them. I trust them wholeheartedly. I remember when when Emily and I first met, I wasn't the director. And I remember thinking when I first started, the students are going to fix these cats. Like, what if, I have to give these owners, what if something happens? But I trust them wholeheartedly in everything that they do. And I take their advice to heart and, pass it. If the animals are in foster to adopt, when they get dropped off to be fixed, I pass all of their advice to them and everything that Purdue said to do. Or if we need to follow up on our vet, I trust that they know what they're talking about. So you also need to trust them and know what they're doing, and don't question, their advice and their findings and things like that as well. I really trust everything that Dr. Curry, Dr. Hill say. So
that's excellent. Our students are amazing. I love our students.
Yeah.
Or-
Yeah,
Pretty
they
good.
are.
Well, we're coming to the end of our time. Before we go, if our listeners, our viewers want to learn more about your programs, where can we send them to?
Cheyenne,
So
you want to
for
start? I
the
have to pull up our website.
yeah, I was gonna say. So for the Humane Society, we do just have like a Google page website. So if you would search the Humane Society of Clinton County, Indiana, and Google it, we'll just go to our Google page and kind of tell you about our foster to adopt program that I implemented a couple years ago to get animals out of here quicker so they don't have to wait until they get fixed to get out of here. It also makes more space for new animals to come in. It talks about what each animal leaves with medically done. It talks about our pricing. It's got, all of our staff's name on there, everyone's roles. You can find our pet finder link on there, which we are constantly keeping up with. And we have a volunteer that comes in and takes pictures for us, thankfully, when I can't get to it. Basically, everything you would need to know is probably found through that Humane Society of Clinton County link on our Google. We also are active on Facebook, Instagram. We have a TikTok. So we're kind of all over the place, but you can find almost anything on that Google page or our Facebook page. If you would search on Facebook, it's the same thing, Humane Society of Clinton County, Indiana. I didn't realize how many Humane Societies of Clinton County there were in the United States. So we have to have that comma Indiana at the end, and you should be able to find us pretty easily.
Yeah. And then our website for Priority for Paws, it's an offshoot from the main Vet Purdue website, but it's vet.purdue.edu, and then it's /priority for paws, and the 4 is the number 4.
Excellent.
Yeah.
And I'll put all of that in the show notes as well, so people will have it handy. And this has been excellent. Thank you so much for being on the show. It's absolutely wonderful. Everything I had envisioned for the podcast.
Oh, it's been a pleasure. Yeah. It's so fun for us to get to do something like this outside of our normal day-to-day.
Well, that's a wrap. If you like this episode, please subscribe, rate, and share it with your friends. And remember, together we can change the world. So use your powers for good.